Friends, I'm going to tell you today how to look for the upper lip and the nasal bone in a fetus. This is the scan of the head of the baby. You can see that this is the head, and on the posterior side you see the posterior fossa and the cerebellum, but the head etc. and the upper lip etc. we have to go anteriorly, and we are moving anteriorly. You can see both the orbits, and in the center you can see the nasal bone and the nose. And if I tilt my probe like this, then I come to the coronal view of the face. This is the mid view between the coronal view and the sagittal view. This is the upper lip, this is the mouth opening, this is the nose, and this is the lower lip. This is the way. Now if you tilt the probe slightly more, you see that this is one nostril, this is another nostril, this is the upper lip, and this is the lower lip, and this is the opening of the mouth. And this is very important to see, because this is the way you rule out the cleft lip. And you see, when you say right that both the nostrils are present, this is the way you look for the nostrils. And if the baby swallows, you can confirm that this is the upper lip, and upper lip is beautifully seen in this baby, and both the nostrils are also beautifully seen. And this is the way you tilt the probe. Just small tilt of the probe is sufficient. You don't have to move the probe much. Now the baby has swallowed, and the baby is swallowing. And when the baby swallows, you can at times see the tongue inside. You can see the tongue inside. This is the tongue inside. This is the tongue inside. And this is the nose. This is the nasal bone. And I go to the same view again. Just tilt the probe slightly to 90 degrees or maybe less than 90 degrees. You can see. And here you see this is the just below the nose in this view. If you tilt the probe slightly more, you can see the hard palate also. This is the hard palate. This is not the hard palate, but this is the hard palate is seen somewhere below the nose. I think this, I am going to show you in the picture just now how to look for the other views of the nose. This is the opening of the mouth again. And this is the nose. This is the nose, you can see. And the nose is this is the section of the coronal section of the face at the level of mouth. And you are seeing the upper lip, and this is the lower lip. And these are, if you tilt the probe slightly, you can see the nostrils. If I turn the probe 90 degrees, I come to the coronal section of the face. And here I see this is the hard palate. There should be a small gap opening over here. And this opening signifies that there is no cleft palate. This is the hard palate. I think this completes the examination of face of the upper lip, nose, and the hard palate. Thank you very much.